Let's get into some practical tips for shaving, hair care, dressing, and nail care. The everyday parts of grooming that can be tricky at first, but get easier once you know a few tricks. Some of this might already be familiar to you, and that's great. Even so, it's always good to refresh, since a few small techniques can make a real difference. Shaving. If you're shaving your loved one's face, always go with the grain of the hair growth. It prevents irritation. Remember that skin naturally gets thinner and more fragile with age, so hold the skin gently but firmly so it's smooth under the razor, which helps avoid nicks and cuts that can take longer to heal than you'd expect. And afterward, a little aftershave or lotion goes a long way. For a lot of people, that small ritual makes them feel like themselves. If your loved one is resistant or agitated in the moment, don't force it. Take a break. Talk with them about something else for a minute, or try again a little later. Pushing through resistance usually backfires. It can make the next attempt harder, not easier. Hair care. Combing or brushing hair is a small task, but it matters. It's often part of someone's daily routine and sense of self, and it's an easy way to help them feel put together. A wide tooth comb or soft brush usually works best for thinner, more fragile hair. If your loved one's hair is tangled or their scalp is sensitive, work in small sections and start from the ends rather than pulling straight through from the roots. Dressing. Dressing doesn't look like physical work, but it actually demands a lot of movement, reaching, twisting, bending, and balancing, often all within a few seconds. For someone with arthritis, osteoporosis, or stiff, painful joints, that combination can turn a simple task into something exhausting or even painful. Slowing down and adjusting your approach makes a real difference here. A few small adjustments make dressing much easier. Lay clothes out in the order they'll go on, and hand items over one at a time with simple instructions. Arm through here, rather than a long explanation. Clothing with larger buttons, elastic waistbands, or front closures is generally easier to manage than zippers or pullovers. If your loved one has a weaker or more limited side, say from a stroke or an injury, always guide that arm or leg into clothing first. It's easier and safer than trying to maneuver it last. A handful of simple tools can also make dressing more manageable without you having to do everything by hand. A reacher or dressing stick for pulling on pants or grabbing something just out of reach, zipper pulls that are easier to grip, and a long-handled shoehorn for getting shoes on without bending all the way down. Letting your loved one do what they can, even if it takes more time than doing it for them, helps preserve their independence, and that patience pays off in a more enjoyable experience for both of you. Nail care. For nail care, keep nails trimmed and clean to avoid scratches or infections, but don't cut them too short, which can lead to ingrown nails. Toenails, especially, can become thicker with age and harder to trim. If this is true for the person you care for, consider taking them to a podiatrist to have their nails trimmed professionally every 6 to 12 weeks, depending on their toenail growth. If your loved one has diabetes or any circulation problems, it's best to leave nail trimming to a professional, since even small nicks can take longer to heal and raise the risk of infection. If you're not sure whether that applies to your loved one, that's a good question for your care navigator. None of this needs to be perfect. What matters most is that your loved one feels safe, respected, and like themselves throughout the process and afterwards.